Welcome to Earrings Off. I'm Lou.
And I'm Teresa. Let's get started. One thing that I've been thinking about since we last spoke about COVID, the fact that it's just so troubling to me that so many Black people are dying.
Mhm.
And so many Black people I'm hearing aren't taking it seriously.
Yeah, I
Like,
know, right?
and I just don't know what to do or say. And it's, people have got to use their platforms to get the word out. And I don't understand why we are so quick to not we are so quick to, as a community, we're so quick to jump on things like Gail King and her interview and not take something that's life threatening serious. You know what I mean? Like beat up on Gail King. I don't understand how we think, you know?
Yeah.
And it's just really bothering me. It's like, how can you not think that, okay, it's a virus, protect yourselves, stay at home, you know, just stay at home.
Mhm.
And I don't know, people are talking about how inconvenient being quarantined is. Well, yeah, it's an inconvenience, but it's going to save your life, and it's going to save others' lives. I'm mad at people right now for not taking that serious.
Yeah.
I
Say,
don't use the
see
word.
what you have. And then, because
Yeah.
if you're right that we're quick to jump on Gail King, Snoop, and Ti, but this is important stuff, you know?
I'm so mad about it, Lou. I don't know why it struck me so, but I'm just so angry. I saw the stats yesterday in Louisiana. 30% of the people who live in Louisiana are Black.
Mm-hmm.
They make up 30% of the population in Louisiana.
Mm-hmm.
70%, they're making up 70% of the deaths.
Mm-hmm.
That doesn't have to happen.
Right.
And then I see this Caucasian minister. I don't even know if he's in Georgia. He's somewhere south. And they've already arrested him once, and he's
Okay.
holding church again tomorrow.
Yeah.
And the
But see,
majority of his parishioners are Black.
well,
What the hell
but
is wrong
see,
with them?
but that's just crazy because people, you're hearing the information. You have to make your own assessment. My sister-in-law said this best when this thing first hit, and I asked her. I called her. I said we were chatting. I said, "Are they having service tomorrow?" She said, "I said, are they having service next week?" She said, I don't know. Don't care. I don't need them to say what they are going to do, whether we're to come or not. She said, I'm taking in the information and I will make the decision for me and my family. She said, so we're not going. So I don't know if there's an announcement or not. She said, we're not going. And when we decide it's safe to go back, that's when we'll go. And I told her, I said, Brenda, that is so good because that's what we have to do. My goodness, it's like they used to tell us in elementary school, put on your thinking caps for goodness sake. Take in
You don't even have to think about it.
right, right.
When they're telling us day in and day out, a lot of it is mixed messages and the fact that people don't respect the president. But don't let
Right.
yourself and your family members die
Because you
because
don't
of
respect
him.
him. Right, right, right. And because yeah, and it's like, okay, so don't cut off your nose to spite your face. Really make solid decisions. And the reality is, it's just like you said. I mean, people are tired of being in. I am, and
Oh
you're
my
fighting
goodness.
that. You're fighting that all the time, and you want to get back to your normal routine, but I want to live and I don't want to make other people sick, you know?
Here's the thing about that normal routine.
Yeah.
What we're dealing with right now is
Yeah.
not normal.
Right.
So people create a new routine
Right.
that will last as long as you're quarantined.
Well,
You know, Create
and
a new routine. And
well,
then
and
instead of moping around and saying, "Oh, woe is me," take on a different stance and say, "You know what? Today I'm going to read that book, or today I choose to be happy and
and you
and
know what?
glad that I have a house to be in." You know, there are people dying. There are people out there who don't even have food to eat. You
Right.
know, there are people who lost their jobs,
Oh my
you
goodness.
know, and thinking about and having these parties and taking the opportunity,
No.
to have parties and all of that. I think I might have shared with you about a colleague that called to share one of the things that they focused on in the conversation was that people aren't taking it seriously, and she had so much to say about it. Husband is golfing today and with with friends, with
Mm,
neighbors, and my taking the opportunity to walk to Starbucks. I it just blew my mind. I'm
yeah,
sorry.
yeah,
I love Starbucks and a social opportunity just as probably more than the next person. you know and but now is not the time to be getting together, because we think about life, but that neighbor might have went and had a haircut, right?
hmm,
And the person cutting the hair might have been cutting the hair of someone from Italy, say.
right.
You just don't know how this thing, you don't know how people are getting exposed, and is asymptomatic is a real thing. And what it means is that people have it and they're not showing symptoms, but they can pass it on to you.
Right,
You can then be asymptomatic and take it to your mother
right,
or your grandmother or
right,
a nursing home. How do
right.
we think that people in the nursing home are so impacted? It's because
About
someone
yeah, yeah,
without symptoms
yeah,
carried it in there.
yeah, yeah,
Stop it.
yeah, yeah. And you're right. You're
I
right.
mean, I hate to sound so upset about it
Well,
and
it is
be
upsetting.
so irate, but I am. I'm mad
Yeah,
because I don't want to be stuck in the house in my basement every day working either.
yeah, yeah, yeah. And but Teresa, you and I did an earlier podcast about being uncomfortable and
Yeah,
learning to get
yeah,
comfortable with being uncomfortable.
yeah,
And I think that's what we have to focus on during this time, that the reality is these are not our normal times.
mm,
So we are going to have to get comfortable with it not being our normal routine and doing, like you said, figuring out what can we do to help get us through and others through without without us losing it, losing our humanity as a group of as a nation of people, and
yeah.
losing our care for one another, losing who we are. So how do we get comfortable with that? And I think it requires that we look at things through a different lens. It's just like you were talking earlier, and we've been talking about these ministers holding service and people all out of whack because it's Easter and they can't go into a physical building. And there's something wrong with that
Yeah.
we can't,
Yes.
we're not a people that can understand, that understands that right now that's not an option, and it doesn't make you have any less faith or be less of whatever religion you may be when your holiday comes forward. But you have got to take precautions to keep yourself
You
and
know,
others safe.
Lou, you're absolutely right, because and we have a brain.
Yeah,
I mean,
but
we have to be smart in this, guys.
yeah,
We have to be so smart. And I'm gonna tell you, churches have rallied. Spiritual places have rallied, and they're making things available to us so that we don't have to put ourselves and I really have to question. I'm sorry, and maybe I don't know if I have to question a pastor who will still hold a service when parishioners. I have to question his motives there.
Yeah.
Like, is it about you, or is it about the safety of your people? And certainly, if it's a mega church with thousands smaller churches, my home church in Georgia has an online option, and it's a small country church, so I know a mega church has that option.
Right, right,
we
right.
have got to be we've got to be smart, and I don't mean to leave out any other um racial group, but Black people right now, we're getting it. I mean,
I'm
it's
telling.
happening to us. We're already a minority, okay? Do you guys know what that means?
Right.
And now we're dying off in untold numbers, and it's mostly our men. Come
Well,
on,
see,
people. This
and
is going to impact us in ways we don't even know
right,
yet.
right. And particularly when we think about we're not changing behaviors, which are then causing us to be exposed or to carry the virus unwittingly into other environments, we're already at a significant disadvantage because we have a large percentage of us have pre-existing conditions which make
Oh,
us unable
oh,
to fight this virus successfully. So when you think
you,
about that, that's a double whammy. And one of those you may have been able to control the pre-existing condition some time ago, but now that we're in the thick of this battle, it is what it is. So let's say factor X can't control that at this point, but factor Y, your ability to take this seriously and to practice all the various um, protocols relevant to keeping yourself safe, the social distancing and wearing the mask and all of that, that is within your control. That's
it
something you
is.
can take charge of right now.
You know what, Lou? You are, girl. You're preaching.
You know,
I didn't even think about to even say that.
but it's
These
true.
it is so true, and it is so very true.
Yeah.
And we need to get a grip. And after this thing is over, we're gonna have to look seriously at these pre-existing conditions that we're so afflicted by,
Yeah.
because many of them, you're right. I mean, we live with them, but many of them, many of the pre-existing conditions, we can talk about those after this is over,
Right.
because many of them we can control and even eliminate with some
Right.
lifestyle
Right. Right.
changes.
Yeah. 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 And
You
we
know,
need to deal with that. And that's what you and I have been talking about, our health.
yep,
But right now,
yep.
that is what it is.
It is what it is, and because it is what it is, we need to stay put.
Yeah. Yeah.
We need to stay at home. We need to practice social distancing. And I tell you, I have had a few library books, and because we've been sheltered, and we just took a drive. We took the long way back home.
Mhm.
And in that, I tell you, we passed many houses where there were 10 cars lined up at a home.
Mhm.
And I'm like, really, people? Really?
Yeah.
That you can't, you're not social distancing if you're gathering in someone's home.
Yeah.
It's probably family members, it's a holiday.
Yeah.
Good Friday is a holiday for many people. And you know,
But yeah, this is just it's just like you say, we talk about so many issues that current events and things that impact our community, but we cannot miss this time to say to people, please stay home. Try to protect your family and protect your health. And it's just like Teresa, I tell you, I was telling the neighbor, I said, no, we're staying in and we're following the protocol because the reality is dying is one thing. Okay. If you die, Yeah, don't want to die, but that happens. And okay, what I'm having problems with in this whole COVID-19 is the suffering that precedes that death. This is
Yeah.
not an easy transition.
Yes.
And you know,
Yeah.
I already told you, I don't handle pain well. I don't. So it's like, wait a minute.
No,
You mean
you
it's not gonna be like you just quickly leave? You mean I have to suffer before? No, that's not gonna work. That's not gonna work.
you know, we make light of that, but it's a true thing for me as well. And
No.
that's one of the reasons why I'm staying put. And I have to tell you, my company, they're actually looking at, there's a team put together to bring us back into the office.
Yeah.
And my first response was, okay, what's the date? I mean, I
Yeah.
understand putting together a team to plan it out so that we responsibly coming back into the office, but I hope that we're not planning to do this
Right.
before the governor lifts this
Right. Right.
this what is it called, this what
The
the quarant
stay at home order.
yes, the stay at home order. and and I hated to be that one to sound off in that way, but I'm not
Well,
coming back until
it's funny. I got an email last week from one of the boards that I'm on, and they were saying, the secretary to the board sent an email saying, well, because she said, well, she just wanted to make sure that we're in agreement. We're not going to have a board meeting until the governor, lets us know it's okay. And I'm thinking to myself, you didn't even need to ask me that. No, that's not going to happen. Just send the emails out to everybody. I mean, I just figured folks knew, but let's be official. No, nothing's happening until then. No.
right.
No.
I mean,
I mean,
because
folks, just so Teresa and I are just a two-person crew here at Earrings Off. And she and I have not met in person since this happened.
we have
Um,
not.
we
We
have
have not.
we are doing this remotely, and it's been challenging because the technology just doesn't challenge us. It's the actual, sometimes you drop the recording and all of that, and we are doing our best to make it work, but she is ensconced in her home and I am ensconced in mine, and that's the way it is.
Right.
Yeah.
That's the
Yeah.
way it is.
Yeah, because we
That's
are.
the way it, and the people that we interview are in their homes. So we are trying to make it work
Yeah. Yeah.
remotely to protect ourselves and those people that we come in contact, we would have normally otherwise come in physical contact with.
Right. And we have had to revamp things. We had a schedule of podcasts and blogs, and this has caused us to revamp our schedule and see how can we pivot to keep Earrings Off strong. But we too are trying to get comfortable with the uncomfortable.
That's
And
right.
but I agree with you, Teresa, that during all of this, we just have to really think about what's going on in the world. People are losing loved ones. And if you think this is not serious and you're not taking it seriously, I think about people, so many people impacted. When you lose a family member, that's devastating without question. But I don't know if people get, when you work with someone every day for 5 days a week, they become your surrogate family. So people are going to return to offices and somebody's not going to be there
Yeah,
as
I
a result of
know.
the virus. That is
Yeah,
jarring to think.
it's
You may
it
have
is.
lost, and whether people, you may not get along all the time on your teams, but you greet each other good morning, you talk about your kids, and they become your surrogate family. I have colleagues that we've talked about our kids so much that I never met them, but I felt I knew this child and I cared
Right.
for this child. So when you think about the devastation in your own family and an extended family, but people, this is larger than that because you have other relationships that you may not even be aware how precious they are to you. So we
Right.
we have to think about that. And I read something online yesterday, Teresa, about um, a man, I think he was in Maine, and his main source of income, he did public speaking and apparently was doing fairly well. But as a result of COVID-19, of course, all of his engagements have been canceled. Okay,
Right.
no gathering. And that has impacted his ability to support his family and, of course, not pay his mortgage. And so he's dealing with that. Well, actually, he was renting, and he sent a letter to his landlord to say, I want to give you a heads up. We are not going to be able to afford this. We have some savings. We can afford to live in our prior apartment because that was smaller, and they'd only been in this new place a few months. So we're going to have to return there. We can't afford the new place. And I'm sorry, but what I'm most concerned about is we're going to have to break the lease. And I know that's going to, go against my credit, and it's going to really impact us. And I just can't make it work for my family in this new place. And so what the landlord did was respond to him by saying, you know, if you want to stay, we can work with you because everybody's having a hard time. But the renter had already said, even if he offered me to stay, I can't stay without paying it. I can't pay this. But the landlord said to him, he said, you're not going to get anything reported by me, and you are free to go because everybody is having a hard time. But the reality
Right.
is, this is my income, and so I'm going to have income, from this apartment. But I will work with you. I'm not going to report anything on you, and you may leave. And the guy was just overwhelmed with the emotion that this landlord was extending him this courtesy. And, I'm saying that to say that when you think about an example like that, it's
Right.
very clear for us to see the kindness in that. Okay, because
Yes.
we know the landlord had every right legally to impact this renter
Right.
negatively, right? We can see the kindness in that. But what I want listeners to somehow think about, there is a kindness to others in you following the protocol.
Yeah.
There is a
Yeah.
kindness
You're right.
that
You're
you
right.
are
Yeah.
extending. It's
Yeah.
what you can do. You may not be the doctor at the hospital. You may not be the nurse, the respiratory therapist, or all the other hospital personnel. Then, if you don't get to wear that crown to be the angel, what can you do? What can
Exactly.
you do in your circle?
All right.
What you
You know,
can do is control what you have control over,
that's
what's
right.
within your sphere of influence.
That's right.
And that can be you doing what you're supposed to do and calling other people in your circle out when they're not doing what they're supposed to do. And not in a negative way, but just asking them to think about that. Do you really need 10 different packages of the toilet paper? Or could you leave some of that? Or
Right.
do you need to make a trip to the store every day? Can you wear your mask? Can you
Mm,
practice social distancing? Can
right.
you just do what you can? And can you be a little, even during this time, parents are having a hard time. I'm a parent. I don't know how I would fare if I had, minor children that I had to entertain and role model for during this period. But
It's tough.
try to be a bit more gentle with yourself during
Hmm.
this time. But it's a good lesson to teach them that, yeah, sometimes life takes a turn we didn't expect. So what are you teaching them to somehow manage when life takes a turn that we didn't expect? It may be the COVID-19 today. It may be tomorrow, them not getting in their school of choice, them not making a team that they worked hard for. Or it could be anything, or worse, even worse than that, them becoming adults and not being able to conceive a child that they thought all their lives that would be their story. So, this is a time to
This is
model
yeah.
what you do in times of adversity, who you are. Really, it shows. So as a race of people, as a community, is we've always fought for equality, to say, we're no different than you, we bleed the same. Well, yeah, we do, and we can all get the COVID-19 virus the same way. So
And we should hunker the same.
right.
I mean,
Yeah.
we gotta take this seriously.
Yeah.
Yeah.
And even more so, because the research shows we have the research shows that we have a greater degree of pre-existing conditions. That's our reality. Now, we can debate all day about why that's so. The inequity that's profound in that actual fact. The fact that we don't have access to health care, the choice, the limited choices in terms of food deserts, all of that.
All
All
of
of that
that.
impacts us being where we are. It's not that we're ignorant or any of that. It's just the racism that runs rampant, even in terms of our day-to-day existence. That's the reality. But as I said about pre-existing conditions and the racial impact, we can debate that. But right now, stay safe. It's serious.
They say.
Yeah. Yeah.
Yep.
So, I mean, that's what we wanted to talk to you about today. And we say this with love. It's a hard message, but please be smart about this. You're better than this. Let's take this seriously, folks. Because here at Earrings Off,
When we know better, we do better.
take good care.